My granddaughter's wearing it.
Okay. First,
Oh,
do you swear testimony you give the truth, the whole truth, and nothing but the truth?
yes.
All right. Got these microphones. They're not really good, so you're going to have to speak right into it, okay?
Okay.
Thank you. You may proceed.
Thank you, Judge. Good morning, ma'am. Will you please introduce yourself to us?
My name's Robin Ressel,
And Ms. Ressel, where are you from?
Springfield, Missouri.
How did you get here to Austin?
My family and I drove down yesterday, 10 hours.
All the way from Springfield?
Yes.
And is any of your family here in the courtroom today?
Yes, my daughter Jessica's here.
Who's with you?
Uh-huh. And her daughter, Errol, and my granddaughter. She's 6. My son, Kevin, he just graduated high school. And then my husband, Dan,
And is that Dan over there
Yeah.
with his hand up?
in the matching shirt.
Let's talk about Jessica. Is she a cancer survivor?
Yes, she is.
And from what type of cancer?
She had a brainstem tumor known as a DIPG.
Okay. And in what year was she diagnosed?
She was diagnosed in 1996.
How old was she then?
She was 11.
And you said a DIPG tumor. Did anyone give you any sort of prognosis on how severe of a cancer that is?
We were told it was inoperable, and
who told you that?
it was the doctor at the Children's Hospital in St. Louis,
Okay. And do you recall his name?
Dr. Kaufman.
Did he give you any sort of prognosis on how long Jessica would survive?
The prognosis was roughly 8 to 18 months.
Okay. And did he make any recommendations for treatment?
Standard radiation.
What did he tell you that the radiation would do to her?
The host of different side effects that it could create. They kind of explained they would shoot the beam through her ears, what it would affect her hearing, diminish her hearing, or she'd lose her hearing. The burns where she would lose her hair around her ears. They just gave us a whole listing of what the possible side effects were. They couldn't really predict for certain. And when they were talking about things like it could affect maybe motor skills, it could affect her IQ, just the different quality, the quality of life that she would have had would have been not good.
And even with radiation, what was her prognosis for survival?
Still death.
Was there any percentage of success given to you? Any likelihood of success?
No. We'd actually asked the doctor at the hospital in St. Louis if we could have maybe reference of someone who has survived long-term, who's gone through the treatment, kind of what they experienced, and there wasn't anyone.
Okay. Let's talk about the symptoms you noticed in Jessica. What were those that caused you to bring her to the doctor?
Oh, her eyes just looked really grotesque. Her left eye was severely crossed in, and within a span of just maybe a couple of weeks, her eyes went from looking kind of funny to just nasty.
Okay. And so where did you take her?
Originally, we went to the Eye Institute in our hometown and saw an ophthalmologist, and he instantly said, "Can you please go do an MRI," and set up us to have an MRI done that same day.
Okay. And was it at that MRI that you found out Jessica's diagnosis?
We saw him the next day when the MRI result was back, and that's when we got the diagnosis from the eye doctor. He'd already reached out to St. Louis Children's Hospital and already had made a plan for us to go up.
Did the doctors tell you anything about what you could expect in terms of Jessica's growth and maturity with radiation treatment?
Yeah, that was a concern I had, that she was 11 at the time, and how girls mature and start a period and so forth, and that was a big concern that I had. And the doctor just point blank told me, frankly, Mrs. Ressel, she's not going to live that long.
Not going to live to be past 12.
Yeah, basically that I wouldn't have to worry about her becoming a female and becoming a woman, because she isn't going to survive that long.
So is it fair to say that if she hadn't been cured, heroin wouldn't be here?
Oh, absolutely. Jesse also has her son Chase. He's 11 and he's at home.
Okay.
You know, if I wouldn't have had grandchildren for certain.
Let's talk about how you found out about Dr. Burzynski. Who told you about him?
Believe it or not, my mom, the dentist she went to in the Kansas City area, the dentist had a father who had been a Dr. Burzynski patient back in the early 1990s, who had had just tremendous success, and gave me the clinic's phone number. And that was also the same weekend or night Mary Jo Siegel was on one of the news shows, 48 Hours, or one of the news shows.
Okay. And so what did you do?
I made a call to the clinic the next day.
Were you able to get an appointment?
We actually got a call back very shortly, within, I'm going to say, a day or two, from Barbara Burzynski. And we were setting up a time that we could get to Houston.
Okay. And tell me about, after you come to Houston, what the atmosphere is like in the waiting room.
Oh my God, it was so positive. It was so encouraging. It was so motivating and so uplifting.
Uplifting from what you learned from other patients?
When we first got there, there were others in the waiting room, and it's like people would travel in from their homes and different states or whatnot, and you would go and meet them and talk to them, and it was just nice to know there's other parents out there with kids facing cancer, and it was kind of like supportive.
And when you met with Dr. Burzynski, was he optimistic about treating Jessica?
Yeah, he was very optimistic.
Did he make any guarantee to you that he'd be able to cure her?
He never said anything about being able to cure her, but he said that he had good success with her type of cancer, and was just very positive and very hopeful. He offered us a lot of hope.
What's part of the reason you chose to have Jessica treated by the Burzynski Clinic? What you learned from other patients of his?
That the great success that they had, and we had no choice. We had to do something. We had to do something to save her life. I'm sorry.
It's okay. How did that compare with patients, if any, that you heard of receiving radiation?
When you look at some of the other patients that had already come, who'd gone through some rounds of radiation, and they were kind of coming as another choice. You know, Jessie hadn't gone through any radiation, so she still looked normal, but you would see children that would have the big moon face, that would be puffed up and swollen. It was heartbreaking.
Was Jessie enrolled in a clinical trial?
Yes, she got very lucky, because she fit right into that perfect criteria.
And what was your understanding of the medication she received?
What
was it called?
It was called anti-neoplastinase, ANP.
Okay. And was Jessie able to have a happy childhood while she was on anti-neoplastin?
She did. She wore the backpack all the time, had the catheter in her chest, was hooked up to the pump in the IV bags, went to school, rode her bike.
Was able to play with friends?
Yeah, just a normal kid.
How long did she receive anti-neoplastin treatment?
The IV was, I'm going to say, about 1 year and 10 months, just shy of 2 years.
And how soon do you start seeing results?
Oh my gosh, within the first 5 weeks, her eyes went from like grotesque to totally clear.
What does that feel like to watch your daughter get better?
It was a miracle.
Did she have any side effects or reactions to it?
Nothing that was toxic, but the typical side effects, she peed a lot, because that's kind of one of the side effects, drank a lot, the thirst, and then she was up throughout the night continuously using the bathroom, so she was always groggy and sleepy a lot during the day.
Was that better or worse than the side effects you were told about with radiation?
Oh, 100 times better than radiation.
Was one of the people involved with Jesse's care Eva Kubave?
In the very beginning, I remember speaking to her on the phone a time or two, but not really so much.
What was your understanding of her involvement?
I don't think she was really assigned much to Jesse's case. I think in the early times we might have had an appointment where she might have come in and checked vitals, I want to say.
Okay. Overall, have you had other doctors? Have you dealt with other doctors in
At
your
the
life
clinic?
other than Dr. Burzynski?
Oh,
Not at the clinic, just.
oh yeah, family doctor and so forth, yeah.
How does the care that you receive from the clinic compare to those doctors?
The care from the clinic, very compassionate, very caring, you know, very interested in the care and the success of the patient.
You said Jesse received anti-neoplastons. Did you have to pay for any treatment she received?
We didn't ever pay for the medicine. What we would pay for, I understand, was IV supplies.
Okay. Were those charges fair in your mind?
Oh yeah, when you look at what, if we'd have gone the conventional route and done the radiation, what we'd have paid probably out-of-pocket cost, and what maybe insurance would have paid, I would say doing the anti-neoplastons was much cheaper.
Okay. And to be sure, were you being charged for anti-neoplastons?
No.
Are you and your daughter passionate about Dr. Burzynski?
Oh, absolutely. He saved her life, hands down.
Is there any other reason why you're so passionate?
Honestly,
supporting him?
Dr. Burzynski, God, here I go again. He's a true humanitarian, and I just can't believe it's this many years later. What, my daughter's been cancer-free for 20 years now, we're still fighting this fight. And I've thought, heck, by now, this would have been more into mainstream medicine. Go figure.
What were the results of Jesse's treatment?
The results were excellent, and she's now 31, a mother of 2, saved her life. So it's kind of like, radiation or A&P?
Tell me about what she's doing today other than being a mother.
She is a medical assistant for a big medical clinic in Springfield.
Does she live close by to you?
About 10 minutes away.
So her and her children, you all live in the same town?
Oh, yeah. Yeah, they're a big part of our life, and I'm with grandchildren daily or every other day.
In the past 3 or 4 years, have you been involved in telling a friend about Dr. Burzynski?
Yeah, we've got a very good family friend at home. I don't want to say names, I'm going to protect them.
Right.
But our friends, their little girl, who will be turning 4 in July, God, I can't believe it, was a 9-month-old when she was diagnosed also with a brain tumor. I think hers was not the same as Jesse's. Hers was called a DIPG, I believe. How they kind of described it, it was a 9-month-old baby, and if you look at a man's thumb twice, that would be the size of it. And they went also to the Children's Hospital in St. Louis at first, And the word they used was they wanted to chisel. And my friend Melissa, I said her name, she's like, "You're not doing that to my baby." And they talked to us about Dr. Burzynski, and within a very short time they were down here and they had their little girl on A&P, and she did phenomenal.
And how is she doing now?
Oh, she's perfect now.
And how old did you say she is?
She's turning 4 here in July.
Okay.
I think they do MRIs every so many months to see where they are, and she's doing great.
Is she walking, talking?
Oh, yeah. Yeah, I took my grandkids to her 3rd birthday party last summer. It was a lot of fun. We did barbecue and a pool party.
Great. Do you believe Jessie would be with us if it wasn't for Dr. Burzynski?
No, she wouldn't. There's no doubt.
Is there anything you haven't said that you want to add? Why'd you make the 10-hour drive to Austin?
Well, I mean, I would do anything to alert others that this medicine is truly, I think, a cure for cancer. We've got proof, without a doubt. She did no other treatment, nothing but the A&P. She is a true miracle. I mean, I'm a proud grandmother of 2 now, and Dr. Burzynski, he's a true humanitarian. Thank goodness we had him. He discovered the medicine and was able to share it with so many.
Thank you, Ms. Ressel. I'll pass the witness.
Good afternoon, Ms. Ressel. Am I saying your last name correctly?
Mhm.
Ressel.
Yes.
Okay. My name is Chris Palazzola. I'm the litigation manager for the Texas Medical Board. I'm going to have just a few questions for you this afternoon, okay?
Okay.
And initially would, like to say that, the fact that your daughter is still here and has beaten cancer is a reason to be grateful and to celebrate, and we would join in that as well. And so we're happy that that was the outcome for you, okay, and your daughter. But I do have a few questions that I need to ask, and I'm going to work through those, and I won't take up too much of your time, okay?
Okay.
And the first one would be, have you, and we don't need to know about anything from your personal life unrelated to Dr. Burzynski, but related to Dr. Burzynski, have you ever testified under oath before today?
Testified under oath, no.
Have you gone anywhere and told your story in a public forum on behalf of Dr. Burzynski before today?
Years ago.
What was that?
We went with a big patient group out to Washington, D.C. years ago, 97, 96. And we're there with several supporters and marched in front of the White House.
And what about, have you given statements to the media about Dr. Burzynski and
We were interviewed back years ago by our local news media when we were trying to do fundraisers to keep the medicine going, or the treatment and the trips to Houston and so on. And also we were in documentary, a film interviewed years ago, briefly on our story and Jessie's success.
Would it be fair to say that you could divide your life into sort of 2 segments, the life you had before your daughter was diagnosed with cancer and the life you've had since? And it was a life-changing event.
It was a life-changing event, yeah.
And you credit, no question in your mind, I think you testified several times, that Dr. Burzynski, this man sitting here, is in your mind the man that cured your daughter of cancer.
Yes.
And you would, not suggesting you would say anything that you didn't believe to be truthful, but you would go anywhere and say anything you believe to be truthful to share your story.
I would stand up from the rooftop and share my story. Yeah, he cured her.
Yeah. And you're not getting any sort of payment working for the Dr. Burzynski Clinic?
No, not at all.
You mentioned fundraising, and are you actively involved in fundraising do you have any involvement in fundraising?
Oh, not now, no. back when we were going through treatment and we had to make monthly trips to Houston, if you were driving, that's a lot of gasoline. If you were, you would need help with lodging or food or different things. We did the fundraising years ago when we made so many trips.
Was that but to help your family with expenses, but did you raise money for anybody else?
No.
And you described the tumor that was diagnosed as being inoperable. Is that because of its location? Do you know?
Yeah, it was located smack in the middle of her head and her brainstem.
Okay. And the conventional treatment that was recommended was radiation. Was anything else recommended before you got to the clinic?
Standard radiation, and then we were also told, see, she wasn't a candidate for chemotherapy because it would not penetrate the blood-brain barrier. But what's weird was whenever they were talking to us about radiation in the beginning, they were saying also a follow-up with a medicine called tamoxifen, which made no sense to me because I thought that's what was used mostly for breast cancer.
And did you have any, medical training or medical experience prior, or have you had any at any point in your life?
No, I learned it all on the fly, going through treatment with her.
Fair enough. And the radiation that was recommended, did they give you any indication of why they would do radiation for someone with your daughter's type of tumor?
Well, there was nothing else.
Do you recall ever being told that they might monitor whether or not the tumor was growing over time? Do you recall any conversations like that with doctors before you got to the Burzynski clinic?
They were kind of explaining they would shoot it through her ears, the beams through her ears, and that it was trying to pinpoint the tumor. But what concerned me was that all the surrounding healthy tissue around the tumor, and that's what they were kind of talking about, that the quality of life issues, that it could do this, it could do that, and I wasn't going to take that chance. Her outcome was going to be death anyway.
And did they give you, did they say, how much time they thought you had with your daughter?
They gave us they couldn't tell for sure, but they gave us a range. It could be 8 months, it could be 18 months. I was actually pregnant with child number 3 during this time, and they were saying she wasn't going to live to see her baby brother be born.
And then you talked about how you learned about Dr. Burzynski, and you talked about somebody who knew a dentist whose father was treated there, and then you also mentioned seeing Miss Siegel on television.
Yeah.
Did that happen on the same day or close in time?
Yes, it was. That was the wildest thing.
Okay. And
My mother called that day, and then the 48 hours or whatever the show was on that night.
And did you have any personal contact with Miss Siegel prior to going to the clinic?
No.
It was just, you just saw her on TV and that helped it?
It reinforced, like, we need to be going there. This is something we need to scope out, something we need to try.
Did you seek out, prior to going to Dr. Burzynski's clinic, did you seek out any other alternative treatments? Because I know that they told you radiation was really the only option. Did you seek out any other alternatives?
Not really. I tried, I kind of started reading up and doing like a little bit of things I could learn about good nutrition. That was about it.
And do you have any, do you know what rules apply to physicians who do alternative treatments for brain tumors?
Rules?
Do you know if there are rules that apply?
No.
Okay. Do you have any familiarity with what the rules would apply to clinical trials for an alternative medication or treatment?
Well, in our case, we had to have labs done like every other day, it seemed like. That was one of the conditions. It seemed like starting out, we were required to have labs 4 times a week. And we faxed them down to Houston, and then it went down to like 3 times a week, and then I think it finally went down to 1 time a week. And we had to go down there and get our medicine and bring it back. That's only things that come to mind.
So I guess the answer then would be, yes, you're aware that some rules apply to the clinical trials because you know you had to do these.
Or we had to fit into the protocol, I guess, yeah.
And do you know what is used to determine whether a clinical trial has established the efficacy of a drug or not, and then not the efficacy? Do you know what standard is used to apply to that?
No, not, I mean, I think there couldn't have been any conventional treatment for so many months. It had to be a certain size, the tumor, that type of a thing.
And I understand that you don't have a medical background and you don't actually perform clinical trials yourself. And I understand that because of your daughter's experience, you acquired, you obviously know some of what you were going through. But I guess my question is more, you don't consider yourself an expert in whether or not and what types of rules apply to clinical trials.
I can only speak from our perspective, what we kind of had to comply with because what we were told.
Okay. And are you aware that there are, unfortunately, children and adults that go to Dr. Burzynski's clinic with a brain tumor that don't survive?
Sadly, there's a lot of times people would have tumors, be it what treatment they do, wouldn't survive, and it's sad.
And do you know what the number is, percentage-wise, of patients that have a brain tumor diagnosis that go to Dr. Burzynski's clinic versus have alternative treatment, and what the differential is and how?
I don't know statistics like that, no.
And then, are you familiar with the different grading systems or staging systems for different types of brain tumors?
Well, not just brain cancer, but all cancers. I know the stage 4 is super aggressive, and then stage 1's not so much aggressive.
Okay. And do you know that the different medications and treatments have different success and failure rates depending on what stage and what grade a cancer may be at? Do you know that?
Nothing. I'm sure depending on what stage you have and what types of medication can make an outcome difference. Again, I can only speak from our perspective, what we went through.
Do you know if antineoplastin would be available to patients with a brain tumor if they were prescribed by another physician other than Dr. Burzynski? Do you know if that's a possibility?
Could you rephrase the question?
Sure. Do you know whether or not antineoplastins could be made available to patients with brain tumors if Dr. Burzynski was not the doctor doing that?
If they could be made available?
Yes. Do you know?
That'd be a perfect world if they could. God, if everybody could have it that commonly and it would be mainstream, but is it available now, you mean?
I guess the question is just, do you know whether or not Dr. Burzynski is the only physician that can prescribe antineoplastins or not? Do you know?
I don't know.
Let's look at the minutes there. Pass the witness.
Nothing further, thank you.
Then this witness be excused.
Yes.
All right, thank you very much.
Okay.
You're excused.
Thank you.
Let's take about a 10-minute break and then let's come back and talk where we go from here.
I talked to both sides, and they decided today that this